Stroke is the #3 cause of death in women and kills more women than men. In fact, 1 in 5 women will have a stroke. Do you know how to reduce your risk? Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. When that happens, part of the brain cannot get the blood and oxygen it needs, so it and brain cells die. Stroke can be caused either by a clot obstructing the flow of blood to the brain, which is called an ischemic stroke, or by a blood vessel rupturing and preventing blood flow to the brain, which is called a hemorrhagic stroke. A transient ischemic attack, or what's known as a mini stroke, is caused by a temporary clot. No matter the type, a stroke is a serious medical emergency. Women face several unique risk factors that put them at risk for stroke, including pregnancy, menopause, and being a woman of color. Here to talk with us about the factors that put women at risk for stroke is Molly McDermott, Associate Professor of Neurology at the University of Michigan. Dr. McDermott, welcome to House Calls.
I'm delighted to be here, Eduardo. Thank you.
Tell me a little bit about your background. What kind of medicine do you focus on?
I'm a stroke neurologist. I work at the University of Michigan in Ann Arbor. I currently serve as our stroke program director, and I also run our telestroke program.
I'd like to ask about stroke and the risk factors for women in particular. Is this something women should be concerned about throughout their life or during certain times?
Thanks for raising that question. I think it's a really important question. And when we talk about women, we're talking about a group of people who are often caregiving for others and not always thinking about themselves and their own health. And so I think this is a great opportunity to just allow women to sort of reflect on the fact that stroke can happen to women. It usually happens in the 60s, 70s, 80s, a bit of older age. But there are other times in life when stroke can happen from childhood to young adulthood. And in fact, there is a slight increased risk of stroke in the time around pregnancy related to hormones and other factors. It's a small increased risk. Pregnancy is still not considered a really high risk time for stroke, but it is possible and it is a higher risk than at other times in a woman's life.
How do women and men differ when it comes to incidence of stroke?
Interestingly, if you look at women across their lifespan, women are more likely to have strokes than men. And the reason for that is that women tend to live longer than men, and stroke tends to be a disease of older people. So if you look at women versus men, just at any age, women are actually more likely to have a stroke in their lifetime than men. Now, why should women care about the warning signs of stroke? They should care because there is treatment that we can deliver for stroke, but you have to recognize that you may be having a stroke and seek medical attention quickly. And so unlike heart attacks or heart disease, where patients can have pain and discomfort when they develop symptoms, stroke often doesn't present with pain. And so patients will sometimes say, oh, well, hopefully this is going to go away on its own, and they won't seek medical attention. And so one of the reasons we like to do these kind of interviews as stroke doctors is to try to get the word out that if you're developing sudden onset weakness, numbness, trouble seeing, trouble talking, symptoms generally that start like that, we want you to get to an emergency room as quickly as you can. Call 911. Don't drive yourself. No one will fault you if you think you're having a stroke for seeking medical attention.
That's an excellent reminder. It's always better to get to the hospital and find out you didn't have a stroke than to have a stroke and not get to the hospital. Will the symptoms of a stroke be any different for women than they are for men?
Both men and women will present with focal neurologic signs when they're having a stroke. And what do we mean by focal? Focal means that there's numbness on one side of the body, there's trouble seeing one side of the world, trouble talking, slurred speech. For stroke neurologists and other physicians, those are very clear signs of stroke. But women often also present with additional symptoms like headache, confusion, fatigue, and sometimes those symptoms can lead physicians to go down the wrong track, and that can have implications for diagnosis and for speedy treatment.
Well, speaking of speedy, that presents the perfect opportunity to remind folks of the F.A.S.T acronym to help you recognize the signs of a stroke. If you notice face drooping, arm weakness, or speech difficulty, it's time to call 911. Is there anything else you would want to add when it comes to recognizing stroke symptoms?
So FAST is a great acronym because it's easy to remember and it's very useful. I like to tell my patients that the T stands for time, but it kind of means two things. One, you want to get to the emergency room as quickly as you can. Time is important, and as we say, time is brain. But also, you want to know when the symptoms started, because that can be really important for what treatment options may be available. So, not just time, you need to get to the emergency room quickly, but time. Try to register what time the symptoms started, or at least the last time you know the symptoms weren't there.
That's really helpful, Dr. McDermott. Thank you so very much for joining us on House Calls. Let's recap what you're looking for when you suspect stroke may be happening. FAST means face drooping, arm weakness, speech difficulty, time to call 911. If you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.